So we have a patient here who was admitted to pre-op for an exploratory abdominal laparoscopy. So what we're going to do today is we're going to insert a peripheral IV, or a peripheral IV was already inserted. So today we're going to insert a Salem Sump NG tube, and we're going to suction out any of the abdominal contents, and then we're going to hang sodium chloride over 4 hours. So we made sure that we've got all of our equipment here. Nothing is expired or open, so we're going to go ahead and get started here. Prior to starting, I already did my first med check for my sodium chloride. So, knock, knock, knock. Hello, my name is Lindsay. I'll be your student nurse for today. Do you mind if I place a few items on your bed here?
No.
Okay. Go ahead here. Do my hand hygiene. Okay. And go ahead and get your chart pulled up. All right. Can you verify your name and date of birth for me? Ivy Armstrong. Okay. And do you have any allergies, Ivy?
Just latex.
Just latex? Okay. Nothing in the room that we'll be using today has latex, so we're all good. Alright, Ivy, so what we're going to be doing is we are going to place an NG tube today. I'm going to go ahead and get you lifted up here. Have you ever had an NG tube before, Ivy?
No.
Okay. Alright, so we're going to get you lifted up here. Alright, so before we get you started, I'm going to have to lift up your bed, the head of the bed, to at least 90 degrees. Keep going here. Okay. We just have to do this for the NG tube. Alright, so now I'm going to get the room set up. I'm going to go ahead and provide privacy. And then we're going to move the trash can over and wipe down our area. Okay. All right, I'm going to move my supplies off the bed for you. Go ahead and get some gloves on. Okay. Alright, so we're going to go ahead and get started here.
Just to confirm, please, and then we're going to send you off to X-ray, okay?
Get all of our supplies set up. Alright, Ivy, so you said you haven't had an NG tube before. Have you had any recent traumas of the face or a deviated septum or any nosebleeds?
No.
Okay. Alright, Ivy, so what I'm going to do is I'm going to place this cup in your hand here. We'll use that later on, so you can just hold on to that for now. I'm going to get my supplies set up. Alright, so while we're getting set up, I'll kind of explain a few things here for you. So I'm going to set this bowl here for you. This is just in case you have any gagging or coughing and you need that. I'm going to go ahead and lay a towel over you as well. Alright, and so first thing we're going to do is we're going to run through a few tests just to make sure that everything looks good, and then I'll kind of explain before we get everything out what we're going to do. So the NG tube is going to go in through your nose, down your esophagus, and into your stomach. This will just help us empty out those gastric contents before your laparoscopy that you have later today. And then after that, we'll run a few tests like I said. So we'll go ahead and get started with that. So I'm just gonna get my tongue depressor. Ready to go. I've got my pen light. Okay. I'm gonna go ahead and look up for me. We're gonna check out your nose. Looks
Alright.
good. Go ahead and open wide.
So now we're gonna go ahead and look at
All
the
right,
section.
looks nice and
Go
moist.
ahead and turn this
I'm gonna have you blow your nose for me.
Make sure that we're happy.
Okay. All right, so now I'm just going to go ahead and close one nostril and have you breathe through and see if that feels any better. Go ahead and close and breathe in and out. Okay, now the other side.
How does that feel on the side?
All right, does either side feel better or worse for you?
No.
All right, so we'll go ahead and place the NG tube on the right side.
Your NP, I believe.
Let me hold on to everything here. Okay. All right. Go ahead and open up for me. So I'm just going to go ahead and test your gag reflex. If you feel like you need a gag, we have this little bowl for you, but just be real quick. Okay, open up.
Maybe giving it over 4 hours.
Okay.
So,
All right, looks good.
per hour.
All right, so now I'm going to listen to your bowel sounds just real quick. I am going to have to lift up your gown. Is that okay?
Yeah.
Okay. Just a little bit.
That fabulous text here.
Okay. All done. All right, so we're good to go ahead and get started here. Hand hygiene. Okay, so go ahead and get started. So the first thing I'm going to do is I'm going to get a few pieces of tape out. We're just going to have to make sure that the NG tube adheres to the face so it doesn't move out of place. So we'll go ahead and get that done, and then we're going to measure it to see where we want to place it, okay? Do you have any questions before we get started?
No.
Alright, so I have a piece of split tape for your nose once we get it placed. I can find the tape. Okay, got another piece here. I'll get one more piece. Alright, so we've got everything there. Go ahead and take out the tube. Okay, I'm going to roll it around to make it a little bit more flexible here. Alright, so we're going to start at the tip of your nose, around the ear, into the xiphoid process.
Definitely time now.
Alright.
That's what we like to see.
Here. So it's right about 55, so we'll go ahead and mark that with a piece of tape. All right. One more time. Okay, so here's that basin for you. So the cup of water you're going to drink as I'm inserting the tube. So as I'm inserting, I'm going to have you sip on that and swallow, just so that way it can help the tube go down a little bit easier. During this time, you may find it a little bit uncomfortable, but it shouldn't hurt. If anything does change, you can go ahead and lift up your arm so that way we can know to stop and pause if need be. So I'm just going to go ahead and lubricate the end of our tube here. This will just make it a little bit easier to pass through. Alright, we'll go ahead and get started. Get my pen light. Okay, so I'm going to go ahead and have you tilt back your head. We're going to go ahead and insert. Alright, sip, sip, sip for me. Look. Looks good. We're going to keep going till I feel some resistance. Keep sipping. Alright, so I felt resistance at about 35 on the mannequin. So we're going to go ahead and tape it down with our tape. We're gonna try to get it to stick, but sometimes it doesn't want to, so. All right. Let's see if we got it. Okay. So while we've got that there, we're gonna go ahead and test our gastric content. Okay. So I've got my pH strips and I've got my piston tube here. So what I'm going to do is I'm just going to draw back just a little bit to see if we've got the correct placement, and then we'll double check everything by sending you off to x-ray, okay? We're going to go ahead and get started here. I'm going to pull back.
So it's going to be normal sleep, okay? It's going to be infused over 4 hours. It's going to get you nice and
Okay, so we're going to test our contents. So we're going to compare it here. So it looks like we are at a 3, which is a good sign, between a 4 and a 3. So we're going to go ahead and send you off to x-ray, like I said, just to double check everything. And then once you are back, we're going to go ahead and secure that in a little bit more. Go ahead and throw this away. Drop the cup. And we're going to send you off to x-ray, okay? Alright, Ivy, looks like everything was good to go, so they sent you back up here. So now what we're going to do is we're going to get you ready to go ahead and suction everything out. And then after we do that, we're going to go ahead and start our IVs. So let me go ahead and do my hand hygiene. Do you have any questions for me?
Okay, let me go ahead and wipe down the station. I'm going to sit this down.
Okay. Alright, so the first thing I'm going to do is I'm going to listen to your stomach here.
And just to let you know,
I'm going to lift up your gown.
let your head go any more than 30 degrees. No less than 30 degrees, okay? So I'm going to make sure that you have
Alright, very good. Okay, so we're going to go ahead and get started with our surgery. Okay. Grab our piece of tape.
Alright, I'm going to come check on you.
So the first thing I'm going to do is I'm going to apply this split tape to your nose here. Okay. Take this piece of tape off.
I thought you were gonna forget.
I'm going to wrap one side around. And the other side.
Now you gotta clean up your mess.
I know.
Alright. Looks good. Is everything so comfortable for you?
Yeah.
Okay, so I'm going to take this tube here. We're going to get our suction ready.
It makes more sense having like all the
Okay, so on our section there would be another attachment to this as well. So we're going to turn it on intermittent. And we want it between the green.
glasses to like secure everything.
Alright, so we're going to feel to see that it's working. Looks good. I'm going to go ahead and connect it. Alright, so now that's connected. I'm just going to keep it above your shoulder here. Alright, we're going to go ahead and get started on your IV. So I'm going to do hand hygiene real quick and get everything set up. It looks like it's already plugged in. Okay, so I already did my first med check at the Pyxis. Now while I get ready to prepare it over there, we're going to go ahead and do another med check, and then we'll get everything started. So I've got my sterile, my saline flush, an alcohol pad, my 0.9% normal saline, and my pump infusion set. So we'll go ahead and go over here. grab my paper. Alright. Place everything at my station. Okay, so the first thing I'm going to do is I'm going to supplies. Ivy, do you mind if I use your bed here?
No.
Okay. Alright, so the first thing I'm going to do is I'm going to get out my line. Set everything down. I'm going to grab my trash can.
You are such a funny girl. This is great.
Get a new set of gloves. Okay. Alright, so now we've got our trash can here. I'm going to grab my line. I'm going to throw away this blue piece in the bag. I'm going to make sure that we've got everything untangled here. Wow. Okay, so it looks like we've got everything unkinked.
Out from the other side.
They really compact this in there. Okay, put my cap on here. Okay, I'm going to make sure that everything is clamped and good to go. Alright, so the first thing I'm going to do is I'm going to remove my cap, and I'm going to pry my line. So I'm going to open this and spike the bag. Okay, so now that I've got my bag spiked, I'm going to go ahead and hang it. Okay. Alright, so now that I've got that set up, okay, I'm now going to get everything set up. So we're going to go ahead and spike the bag halfway. Alright, I'm going to go ahead and pry my line. Alright, so we're going to get all the air bubbles out. Alright, so I'm priming my line, making sure to get rid of any air bubbles.
Okay, I have
Still running pretty slow. Okay, so as soon as all of the air bubbles are out, we're going to go ahead and get started with the IV. There we go. Okay, so I'm going to go ahead and clamp it off now. Okay. I'm going to go ahead and get this set up. So before I turn it on, I'm going to open up the channel.
And if at any point you feel the need or
Okay, I'm going to remove this blue piece, and I'm going to hook this through. Alright, I'm going to insert this blue piece here, and plug in this bottom part. Alright, so it looks like everything is good. This is clamped. We want to make sure that it's clamped before we get it started. I'm going to go ahead and close the pump in place. So now everything is ready to go. And I'm going to line this over the top here. Okay. We're going to go ahead and take this off. Okay, so now before I get that connected and set up, I'm going to go ahead and wipe down my hug here for 30 seconds. 28, 29, 30. Okay. I'm going to go ahead and flush it without touching the hose. So I'm going to go ahead and aspirate first. I'm going to unlock the key. Aspirate. Looks good. So there's no infection at the site and no swelling or anything like that. So it is usable. So I'm going to go ahead and leave this here while I go ahead and get everything connected. Okay, so now what we're going to do is I'm going to turn this on. All right, and so what we're going to be doing is we're going to give Ivy the 1,000 milliliters of 0.9% sodium chloride, which is normal saline. We're going to give it over 4 hours. I'm going to go ahead and get started, and I'm going to do this right now, and we're going to document everything. So we're going to give 250 milliliters per hour. So I'm going to go ahead, and on here it says new patient. Because they're new, we're going to say yes. Ivy is an adult, so we'll say yes. And then we're going on channel A, so I'm going to press channel select. And we need the guardrail IV fluids and 0.9% sodium saline. Yes. So we want to do it at a rate of 250 milliliters per hour. And the volume to be given, we're going to give 1,000 milliliters. Okay. So now that I've got everything set up, make sure everything is good. I'm going to go ahead and unclamp the saline and attach this. Make sure this is unlocked. I'm going to unclamp this here and I'm going to press start.
You just tell me what to do and I'll do it.
Okay, so now that everything is running and good to go, I'm going to go ahead and collect all of my materials.
Okay.
All right, Miss Ivy. I'm gonna first inspect.
Okay, we're still doing all right, Ivy?
Yeah.
Great, everything looks good. I'm going to go ahead and lower the bed. But I can't lower the headrail past 30 degrees since we're suctioning. We have the NG2 plate.
Tissue.
Do you want me to lower you or are you good where you're at?
I'm good where I'm at.
Okay.
All right. Read.
Now, so I'm going to go ahead and grab my
I'm gonna
supplies.
include one nostril, and I'm gonna have you try to inhale.
I'm going to wipe down
and then switch.
area.
All right. Is there one that felt better than another?
Oh, definitely the right nostril.
Right nostril. All right. So we're gonna be placing the tube in the right nostril.
Alright, and we're going to go ahead and make sure that Ivy has the call light. So the call light is in Ivy's right here. Alright, there we go. I'm going to do hand hygiene. And I'll be back in an hour to check on you. I'll make sure to document everything that we did today and take all the supplies and we're good to go.